Hello and welcome to the lecture that is the endometriosis. Actually, endometriosis is the presence of endometrial tissue outside the uterus. It can cause a range of symptoms and is often diagnosed through a combination of clinical history, imaging, and confirmed with a biopsy. Hormonal changes during the menstrual cycle also affect these ectopic tissues, causing symptoms. Endometriosis is common, affecting around 7 to 10% of women, with a higher incidence in specific groups such as those with infertility or pelvic pain. It typically occurs during reproductive years. Women who have not had children or who have first degree relatives with endometriosis are at increased risk. Genetic studies suggest that the condition is inherited through complex multifactorial mechanisms, making some individuals more susceptible than others. There are three main theories for the development of endometriosis. The most well known is retrograde menstruation, where menstrual blood flows backward into the pelvic cavity carrying endometrial cells. The Halban theory suggests that vascular or lymphatic systems separate these cells to distant locations, and the Meyer theory proposes that certain cells transform into endometrial tissue under specific conditions. Each theory explains different presentations of the disease. Endometriosis commonly affects the ovaries, the pelvic peritoneum, and areas like the pouch of Douglas. Rarely it can involve distant sites such as the lungs or even the brain. Lesions vary in appearance, ranging from small clear spots to large cysts filled with the dark fluid. Chronic disease can lead to adhesions, causing scarring and distortion of pelvic anatomy. Symptoms of endometriosis vary widely. The most common complaints include progressive dysmenorrhea and deep dyspareunia. Chronic pelvic pain often results from adhesions. Infertility is another frequent concern, affecting up to half of women with endometriosis. Less common symptoms include gastrointestinal or urinary disturbances, depending on the location of the lesions. During a pelvic examination, classic findings of endometriosis include uterosacral nodularity and retroflexed uterus fixed in the pelvis due to adhesions. Ovarian endometriosis may also be tender or palpable. However, these findings are not always present, making diagnosis challenging without surgical confirmation.